Hi, Whitney.
Welcome to the podcast where we acknowledge that the ways we are working really aren't working anymore.
We invite you into conversations with thought leaders, coaches, and industry experts to explore strategies for living with more ease and less grind, more flow and less fight. Welcome to Untrained. Hey, Whitney.
Good afternoon, Iris.
Yes, it is an afternoon, not the morning. And we have a very exciting guest. So I'm going to read the spiel and then I'll throw it over to you because you have a connection with Bonnie. So we have Dr. Bonnie Zucker on with us today on Untrained. Dr. Bonnie Zucker is a clinical psychologist located in Los Angeles, California. Whitney loves Los Angeles, by the way.
I love you have to say it like that. Los Angeles.
I love Los Angeles. Who has been working in the area of anxiety disorders for over 25 years. She received a Ph.D. in clinical psychology at UCLA, where she developed a specialty in the research, prevention, and treatment of anxiety disorders. Since graduate school, she's worked as the director of behavioral therapy programs at Cedars-Sinai Medical Center. Oh, wait, that's currently. Sorry, I'm supposed to go back. We'll cut that out. Currently, Dr. Zucker has a private practice in Los Angeles and trains other mental health clinicians in anxiety disorder treatment and prevention. She also writes articles on mental health for Psychology Today. I've read some of them. They're great. So we will put the links in the description and for other media outlets. She recently launched an online course for people who are struggling with panic attacks. And at the end, we can give you a code and we'll put it in the description as well for our audience. Whitney, tell us how you know Bonnie, and then we'll bring her into the conversation.
Well, I've heard Bonnie's name for years, but recently my husband my husband and all of us went to Seattle for the ABCT conference, and Bonnie was at a dinner, and it was one of those things where I was like, let's go outside so we could actually hear each other and we can really have a conversation. And we were talking about the work she's doing. I was talking about the work I've been doing. And I was so drawn in by how passionate she was about presenting the information and having, her work really helps people with anxiety, particularly people with panic attacks, gain some skills to deal with them in more effective ways. And not only that, another thing is she's really been working on reaching people. And so in addition to the Psychology Today, she also has a TikTok, is it TikTok channel or TikTok account or TikTok?
TikTok account.
TikTok presence. Yeah. And I'm also, as someone who's been working on social media, she really focused on it and went from 0 in the last 9 months to 10,000 followers. And that also really impressed me and speaks to the relevance and power of her work. So we're going to be learning from her today. And one of the things when I was thinking about what are we untraining? So I think very often anxiety and panic, we can try and control it. We try and double down. We try and muscle it, right? Particularly as athletes, we just want to tighten everything up and batten down the hatches and make sure it doesn't happen again. Not so effective, particularly when it comes to panic attacks. Iris, you and I have both struggled with panic attacks over the years. So this is both a selfish guest positioning because we wanted to learn more. And we know how much our clients struggle with these issues as well. So welcome, Bonnie.
Well, thank you. I'm so glad that to be on the show. And I'm so glad that we really had the chance to talk in Seattle. It was such a great connection. And it's so funny because I first got into working in the field of anxiety was in the mid-90s, and your future husband was my mentor. So it's just kind of almost coming full circle that I'm able to come on your podcast. So that's really fun. But yeah, so I've been working in the area of anxiety, since the mid-90s, so almost 30 years, and when I was in graduate school at UCLA, where I went after I was working with your husband, my mentor was really focused on doing a lot of panic disorder treatment studies. And so there was a lot of cognitive behavioral manualized treatment of panic disorder. So and we did a lot of group treatment. So we'd have these groups of maybe like four people or so, and they'd all be struggling with panic attacks. And we were able to go through 12 sessions with them and really help them to really alleviate their panic symptoms. So I did that during graduate school. And I was also interested in the area of prevention of anxiety. And there was someone in my lab who had done a panic attack prevention study where she basically took the panic treatment that we were giving in 12 sessions and put it into like a 4-hour treatment, and found that that was actually effective in preventing the incidence of panic disorder with people who are at risk for it. So I just sort of started, like, that's where the seeds were planted in terms of, where I really started learning about treating anxiety and panic attacks. And then a few years later, I was working at the UCLA Counseling Center as a staff psychologist. And what would happen is people would come in and they were like students, and they were just at the ER, or they just were at the health center, and they'd come in on what we would call walk-in. So like kind of like an emergency, no appointment. They came in, they were sent over because they thought they were having a heart attack or something, and they'd gone to the ER and they said, it's just anxiety. It's a panic attack. And so I would see these clients on walk-in where I'd have like a really short appointment where I'd have like 45 minutes with them, or sometimes even shorter, like 30 minutes. And what I found that I could do in those really brief appointments was get a quick understanding of what happened, and then provide some of the information, some of the most important information that was from that longer treatment. And really educate them, like what panic attacks are, why, and we figured out why it happened in the first place and what not to do to reinforce them. And then they would come back in like a week or 2 weeks, and by and large, most of them were, weren't having any more panic attacks, and they were really able to integrate like the essential information that we talked about. So it's been really exciting to be able to help people in that way.
And we have at least 30 minutes, so we can do that today.
Yeah, I'm like, help me with my panic attacks right now. I want to ask a pretty basic question before we go into the untraining and training piece of it. For the audience, you said one part of it is education. What is a panic attack? If you could help the audience know that, so we can orient around a foundation. Yeah.
Well, and this is interesting. When we would do the longer, like 12 session, longer like panic treatment, we'd go into a lot of detail about what I'm about to tell you. And I realized, I don't know that someone needs the like intricate detail about like how the nervous system works, how, what this symptom means, like the evolutionary purpose for this particular symptom. So we went into like actually a lot of detail. And even when I was doing that, the longer protocols, I'm like, what? I don't know that people need to know all this. So, what I say to people is, we have what is called the fight or flight response, which was designed by evolution to keep us safe. So if you think back to like, cave times, if there was a cave person who was being confronted with a bear, they would need to either do something. They'd need to have like an anxiety response, and to either, get away, fight the bear, or do something. And even today, we still need that response. Like if you're crossing a street and a car came speeding towards you, you need to have that type of response to like do something. It's quick, like gearing up response. But what happens with a panic attack is that you get that response as if the car was speeding towards you or the bear was running at you, where you get all these physical symptoms, but there is no car and there is no bear. And so what happens is people tend to like look inward, like, oh my God, like I can't breathe, I'm dizzy, and my heart is racing and I'm sweating. Because they can't point to an external reason, they often go inward and think, oh my God, there's something wrong with me. And so when that happens, obviously that makes the anxiety even worse. So it's really this activation of this fight or flight response. And it usually, it happens, usually it's like people are under a period of stress, and it's just like sort of like an overwhelming, it's just it's your body's response to stress, but it's almost like it's an over response to the stress.
Yeah. Do you want to know my definition?
Yeah. What?
You're so terrified that you want to die, to avoid feeling that terrified.
Yeah.
And you can sit there and be like, this doesn't make sense, but I'm still feeling all of these feelings.
Yeah. Well, and often people are afraid that they are dying. Like that's, I see that a lot where, people are afraid that they are dying. So,
Iris, you want to weigh in on your definition?
I'm just like, I raised my hand. Yeah. I don't have a definition, but I know what it feels like. And I have been one of those people who were under an extreme amount of stress and have gone to the ER and have thought, oh my God, I'm having a heart attack. So I've had that. And so I know what that feels like, and I know what that response is. And what you said, Whitney, is so resonant, because when I was in transition I went from owning my own business and now I work full time, I went through a series of that. And so what Whitney said resonates, because that's exactly how I felt. I was like, I want to do anything but feel this right now. And it was very overwhelming. So it's not I don't have a definition, but it's more, I know what that feels like. And it's different than feeling a stress or feeling overwhelmed. You literally feel like there's a car coming at you and oh my God. And there is anything external to point to. So I'm sort of listening to the both of you and thinking, oh yeah, this is resonating.
Yeah. And I think Iris and I've had them for different reasons, right? Like Iris, you have a different history that's led to yours. Mine were really precipitated by 2 pregnancies. And then after my second child was born, I had postpartum anxiety. I didn't even know that was a thing. I definitely had it. And then I also had PACs and PVCs, which is just where your heart sometimes skips around and skips beats. And we do know from the research, because I did live with my husband, is trained in similarly around anxiety, but always saying, when it relates to breathing or the heart, that's often much harder. That's a time when we are more off. Panic attacks show up more often when you have any challenges there. But so I would do the exactly what Bonnie's talking about. Like my heart would start skipping around, and then I would become vigilant to how my heart was beating and want to control making that not happen. And the way I would do that was want to remove stress or get really still, because I wouldn't want my heart to be beating faster. And that just made it worse, because I had all this vigilance and I was trying to control it. So why don't you use me as an example, Bonnie, and speak to what about that is not helpful and what in that situation is helpful.
Right. Well, I think that's interesting that you said it happened after your pregnancies, after you had a child. And, that is a high risk time for anxiety for women after they, having actually various times during the women's reproductive cycle, like even like around puberty, pregnancy, menopause, you will see a lot of increase in anxiety symptoms, and a lot of it.
And some heart irregularities, I've also learned.
Yeah. Okay. Yeah. And just, and it is physiological, a lot of it is physiological, it's hormonal. And, and then on top of it, you have the stress of caring for an infant. So that's like an additional stressor. And, so it's, first of all, just to validate, it's understandable that you had a lot of, anxiety. And I think it is really important for women to know that having, we hear about postpartum depression so much, but actually postpartum anxiety might even be a little more prevalent than postpartum depression. And some people have both. So it's just it's extremely common. And, you know, what's interesting is, so you were saying that you had like you had some irregular heartbeats. Mm-hmm. And so what did you notice when you noticed those irregular heartbeats? What came to mind, or what did that mean?
So, you know, what come to mind is I've had this checked out. It's benign, but my body would tell me I was dying.
Right.
Like it wasn't rational, but it was just this like enormous spike in anxiety. And it was like, you know, I was with children or, you know, taking care of something or presenting even, right? And it was like the outside of me sort of went in as much autopilot as possible. And inside of me, I like curled up in a little ball. Just sort of started to, you know, tried to hide and retreat. And I think the sort of the effort to fake it was also added to the anxiety. So, and then I would get very vigilant. And if I was alone, I would just get extremely vigilant to the symptoms and lock in on them and be sort of like when you have the hiccups and you're like, is that the last hiccup? Or am I going to get another hiccup? You know, you're like, you can't be ultra focused, can't not be ultra focused on your hiccup. And I know that is not helpful, but it was very hard not to do that.
Yeah. Well, that's it. I mean, so basically what you're saying is this started happening and then you became hyper vigilant, hyper alert, hyper focused on the symptoms. Yeah. And then were you having like repeated panic attacks as a result?
I definitely had repeated panic attacks. And the thing that I did that my husband said I wasn't good to do was I would curb behaviors. So like, you know, I love to exercise. I mean, it's so important to me, but I had a fear that if I did sort of the more extreme exercise that I was used to doing, that I would bring them on. So I would do more gentle exercise. And I know, and it's taken me years to sort of get back to where I was and really trust myself. But I would also engage in the behavior of avoidance, which I know also doesn't help. And I have found that the more I could, you know, have the courage to do the things that I was afraid of, the better I felt, the more confident I felt. But sometimes I needed to do that with support.
Right. And yeah, I mean, I think this is like a very classic description of what can happen when you're in a vulnerable place. You just had a baby. You had had these irregular heartbeats. You had a panic attack. You had a lot of stress, and you know, it sounds like you then started to accommodate the panic attack. So you're basically you're giving yourself the message, these are bad. I can't handle these. I need to monitor my body. I need to focus on it. I need to avoid doing exercise that could potentially trigger symptoms. So that's really common with people with panic attacks, is like that your world starts to become smaller and smaller the more you accommodate the panic attacks. And so, you know, what I tell people, you know, initially is like, just to say, like, first of all, this is a panic attack. This is what it is. It is not dangerous. And I would, you know, assess the behaviors that people are doing and assess the thoughts. And I really would work on telling people, like in your situation, like you've been worked up medically, which I'm assuming you've been worked up medically. Yeah. I'd have the people go to the doctor, make sure everything is clear. I think that's really important. And, you know, if you were focusing a lot on your heart, I would say, you know, that reinforces your anxiety, because that's basically telling yourself, I need to focus on this symptom, like make sure I'm okay. That's keeping you in the panic attack cycle. So I would say to someone, you know, when you notice that you're focusing on your heart, you can just gently redirect your attention to something outside of you, in terms of like something in your environment, like, you know, looking out a tree out the window, a picture on the wall, the sensations of the couch that you're sitting on, just something to practice. And this is not even when you're in a panic attack. This is just when you notice you're monitoring your heart, to just practice redirecting your attention. And then I'd also, like what your husband he was right. Like, you really need to not avoid behaviors that you're doing.
One question I have, and I'm only realizing this sort of looking back, was that I felt so much shame about them, and that, particularly, in professional settings, if I was really anxious, they might get bad. But I found that if I could say to somebody, if it was like an iris, I might have these, just so you know, it made me feel so much safer, and it sort of reduced my anxiety. So I'm just curious about that piece, because it felt like I had to hide it. And I think that amplified the vigilance and the anxiety. Could you speak to that?
That's interesting. Yeah. I mean, I think the fact of needing to hide it, probably, again, it's sort of saying this is like a problem, and that probably in and of itself made you more anxious about it. So yeah, I can imagine that, that's problematic. I mean, the thing I would need to understand more is like telling Iris. So on one hand, it's like, okay, this is good. Like I'm being open about it, and it's helping my anxiety in the moment. I'm also wondering if it was like a reassurance seeking behavior, and if it's, people who have anxiety often engage in like excessive reassurance seeking. So I'm not sure if do you think you were asking for reassurance?
I was guilty of some reassurance seeking, definitely. But it was more that if the other person just knew that I might deal with that, even if I never talked to them about it, that was helpful to me. And so I was just curious about that from a clinical perspective, and if that's within the advice that you offer.
Yeah, I mean, I think if it's not like excessive reassurance seeking, like if it's not feeding into the anxiety in some way, then I think that's fine. If it is more about like helping you get over the shame, I think that's great if it's for that reason, and to just being more open about it.
Iris, what are you thinking? What's going on for you as we're chatting about this?
Yeah, I'm thinking too. So I'll start with my experience is in the times of overwhelm or stress. Whitney and I often talk about the untraining of when we're athletes. Oftentimes we ignore signals from our bodies in order to get through to the next step, right? So we have to perform. So just shove it down, and in the short term, just drive it forward. But I sometimes see my panic attacks as like a point where the body's like, enough, like I'm trying to get you to pay attention, because what's happening is a little bit kind of crazy for me right now. So I want you to pay attention. I want you to see me and take some rest or do something. Oftentimes it's centered around not enough rest. So panic attacks can often occur for me when I'm overwhelmed, not sleeping well. And there's something where the body's like, hey, I want you to pay attention. So I think in some ways what I'm trying to ask is we don't want to pay excessive attention, right? Especially at the moment.
Okay.
But what is it that we can do to help either prevent it or I'm just thinking about my situation is I'm wondering, sort of psycho-evaluating myself here. Like, I'm wondering if it's just we're not paying attention and the body is trying to give a signal, right? So, and maybe it's simplification of it, but I think that's what occurs for me is, hey, I want you to pay attention. You need something right now and you're not listening.
Yeah, that's such a good question. I think it's important to separate this out. So if panic attacks will occur during times of stress. And so if you're able to say to yourself, and I think you can't completely prevent a panic attack. Like if you're under enough stress, a panic attack will occur. And I actually, in my panic attacks course, I talk at great length about a panic attack that I had. And why it didn't turn into a bigger problem because I, knew what I knew about treating panic attacks. But I think, if you think about it, it's like panic attacks are response to stress. And if you're able to say, okay, I just had a panic attack. Why did that happen? Like, it happened because I'm not sleeping enough. I'm overextending myself. in my case, it was, it happened like right after 9/11, but I was also like very stressed out about my dissertation, and if you can use, it is like a good signal, like what is going on? Or if you're at a very dysfunctional job, like ask yourself, like, is this worth it? It's causing me so much stress that it's causing me to panic. Is there changes, like lifestyle changes that I can make that are like meaningful, that are going to sort of just reduce my anxiety overall? So like paying attention to like why the panic attacks are happening in the first place. I think that is important. The part that you don't want to get stuck in is like getting stuck in the panic cycle where you're hyper vigilant about your body, like, oh, did my heartbeat did it beat weird just now? Like just being hyper vigilant of your body. That's the problem. Did that answer your question?
Yeah, it makes sense because you talk about this too in some of your work as well, is post-panic attack. There's some actual things you can do to help you.
Definitely.
So
Right.
One of the things that I'm hearing is really taking some time to reflect, right? So it's not bad. So what I'm hearing is it's not bad. It's not good. This could be a signal for really just having some time and period of time to reflect. What is it that might be overwhelming me in the moment? What is happening in this moment? What are some other things that post-panic attack that you can ask yourself or do that you think are useful tools?
Right. So one thing that I do is when I see people, I try to understand why they had a panic attack in the first place, especially people who have like a catastrophic thought associated with the panic attack. So especially people who like they're afraid that they're having a heart attack, they're afraid that they're going crazy, they're afraid they're going to faint. Those are like kind of some of the big ones. So I try to understand why they had a panic attack with that particular fear. And so oftentimes, I might, if someone has this fear that they're having a heart attack, they might, you dig around a little bit and you say like, do you know anyone that's died of a heart attack? Or is there any like particular reason why you're afraid of that? Or people, who are afraid that they're going crazy. Sometimes you'll hear like, oh yeah, I have this aunt that has schizophrenia, or someone who's afraid of fainting. It turns out they actually did faint and they're afraid that it's going to happen. They almost fainted and they're just hyper vigilant about that. So I, in addition to saying like, what are sort of like the bigger stressors that might have contributed to this, I'd look at what their fears are and try to get a better sense of if there was something specific that was driving that fear.
I wanted to ask about my curiosity around hyper-focusing. Why is it that we begin to hyper-focus? That's kind of where my question is it sounds like what you help people do is open the aperture to understanding and taking a step back. Whereas what I'm hearing is when someone is in that panic cycle, which I'm going to use your words, they tend to hyper focus or narrow the aperture. Is there a reason why that happens in that moment? Is it just the self-preservation, or what actually happens in that moment?
Yeah, I mean, I think what happens with people with panic, I mean, part of, so you're in a state where you're like, let's say you had a panic attack and you're afraid of having another one. So your body is then kind of on alert to sort of be aware of signals that there might be another panic attack. So it's almost like, and sometimes it even happens without your conscious awareness. Like your body becomes like conditioned to become fearful of an accelerated heart rate, for example. And so you might be actively focusing on symptoms. A lot of times people, I don't know, like will monitor their heart rate with their watch, or people might, take their blood pressure excessively. Or now since COVID, they take they have these now a pulse oximeter. People can take their oxygen, so people can like monitor like that, or they could just almost be like just just hyper aware that they're aware. But then also it's just, their body's been conditioned to be fearful of certain symptoms. And so sometimes panic attacks can actually seem like they're coming from out of the blue. And it might just be that they're triggered by a body sensation and they almost didn't realize it.
Mm-hmm. Yeah, like there's some surveillance equipment constantly working.
Yeah, there's a lot of surveillance. And it's like you're trying to keep yourself safe. Like that's the reason why you're surveilling it. So, and that's, what makes panic attacks tricky because, when you have, or like when you're driving and there's a police car behind you and they just turn their lights on, you get that. I mean, I've gotten that panic response, but you understand where it's coming from. It's like, oh, I'm about to get pulled over. But it's when you don't have any external stressor is when you start to think that there's something wrong with your body. And then all of the surveillance and avoidance and catastrophic thinking, it all feeds into that fear. And
it doesn't ever get to be done. I mean, with the bear, the police car,
right.
The car heading towards you when you're crossing the street, that the danger has passed. And I think what's so difficult about the panic attack is that I used to just wake up and be like, God, when do I get to go to sleep? Because that was the only escape or rest from the surveillance, the fear, the anxiety,
exactly. And so when I work with sort of more, and people don't have like as entrenched panic disorder, sometimes, it is really just effective enough to say like, just practice, even when you're not panicking, shifting your attention outside of your body and just, tell yourself like, I don't need to be surveilling my body. It's okay. I'm fine. For some people with more intense panic attacks, they might really benefit from seeing a therapist who does what are called interoceptive exposures. So, if they have a fear of like dizziness, like just but you're doing it, you actually bring on the sensations that you're afraid of. So with the dizziness, you might practice spinning around in circles. So it's like you're retraining your brain to realize that these sensations are not something that needs to be feared.
Mm-hmm. Yes.
Yeah. And people hate doing this.
Yes. And really that's where it's nice to be accompanied by it.
Yeah.
With it, right? That you're recreating those symptoms, but you're accompanied. You're not alone.
Like doing it with a therapist. Yeah. Yeah. And then you make a practice plan where they could practice something, practice doing it on their own too. And like try to, do it in a way that, obviously you don't want to overwhelm somebody. So just practice even just, you come up with what feels manageable, but what will kick up the symptoms and what will kick up the anxiety to retrain your brain that these are not symptoms to be feared.
Mm-hmm. Yeah. And what are you finding people are really resonating with and responding to? And just how prevalent is this panic, is anxiety to the level that we're talking about?
Yeah. Well, with panic attacks, it's estimated that between 25% and 30% of people will have at least one panic attack in their life. So, it's pretty common to have the experience of having a panic attack. To have like a panic disorder where you're like, it's really affecting your life. You're having like out of the blue panic attacks. You might be avoiding things. That's a much lower number and just might be maybe 2 or 3%. But there is like a wide range where there's actually somewhere between the 25 to 30% and somewhere between that and the 3%. There's like a what we call subclinical population where people are, somewhat distressed by it. So it's definitely somewhat common, and it's actually more common in women than men too. And I'm not sure exactly why. Some of it, I mean, there's different hypotheses, but some of it might be some of these like lifestyle change, life cycle changes that women experience that men don't. Just the hormonal piece of it.
We've I'm sort of bringing it home. We've talked about untraining the dysfunctional thoughts, some of the hypervigilance. We've talked about untraining that. Is there anything else that, talking to this audience, that you think is important when thinking about anxiety and panic attacks that we should untrain, right?
Right. I mean, I think just in general, one thing that people want to do, they have this belief is, I need to get rid of anxiety altogether. People will come into therapy like, I have too much anxiety. I want to be free of anxiety. Yeah. And that is an important belief to untrain. And I really work because it's not a goal that's achievable. And for most people. And so to work on accepting your anxiety, that it is okay to feel anxious. It is expectable. It's expected that you'll feel anxious in certain situations. So actually just changing your relationship to anxiety, that it's not something that you need to fight against, and that the fight against the anxiety often makes it much worse, and to really just work on acceptance of it. And again, ideally, you don't want it to turn into some huge panic. You don't want to have a huge panic attack, but if you do have a more accepting view of anxiety, when you start to feel symptoms of it, you won't catastrophize. If you can just label it, it's like, okay, I'm feeling anxious because blank, and that's okay. As opposed to like, oh my God, I'm feeling anxious. Am I going to have another panic attack? Instead of working yourself up into a frenzy about the anxiety, you really work on just changing your relationship to it so that it's okay.
Is there a point as a clinician you would say this is healthy levels of anxiety, and here's sort of the line where you would say, I recommend you talking to someone or taking a next step here?
Yeah, I mean, I think you really have to look at how much is the person distressed by the anxiety, how much is it interfering with their life. And, if it's a significant distress and interference, I would say, definitely think about getting some additional help. Sometimes, when I have clients and I just see that there's just a lot of persistent anxiety, it's sometimes people could benefit from medication too. So I think there's sort of all different, it's a spectrum of how much suffering people experience, but there's definitely help available for all levels: severe anxiety, moderate anxiety, mild anxiety. And I think and having these conversations, I think it's just really important for people to know that, to know that there is help and that you're not alone.
Yeah. So we hope that if you experience anxiety or panic attacks, that they're common, you're in good company, and that you can get help to react differently to the symptoms, which can ease the suffering, ease the intensity of the symptoms. Bonnie, you have a TikTok channel and a course that we can put information we can put in the show notes, and a discount for your course.
And so for the untrained listeners, if you put in the code untrained20, you can get 20% off the course.
Awesome.
Yeah. Great.
Thank you.
Thanks for joining us today. This was really helpful. I think selfishly, it was very helpful for me. And thank you. And I hope everyone learned something today. And Whitney, what do we say at the end of every podcast?
Keep on training.
Keep on training. If you like what you hear, subscribe to our YouTube channel or find us wherever you get your podcasts, and make sure that you visit Dr. Bonnie Zucker's website and take advantage of her resources.